Moving abroad is one of the best asset protection and retirement plans. And you may be wondering why I say that. I say that for two reasons. One, as we have an aging population with the baby boomers getting older and retiring, there will be a heavier reliance on Medicaid and Medicare services. Reason number two is what's called as the silver tsunami, which is what we're experiencing right now, which is the largest wealth transfer from the baby boomers to their successor generations, their children and their grandchildren. So we have on one end an aging population that's relying on state-funded medical services, and then we have a large wealth transfer. Because of this phenomenon that's happening, unless an individual or a family did asset protection that went to an estate attorney and put their assets in trusts, in irrevocable trusts that make them Medicaid eligible, a lot of these assets that were expected to be transferred, a lot of this wealth that was expected to be transferred will not be, which is why I'm a proponent of moving abroad, and I'll get into that. So as it is, Medicaid is a need-based state insurance program. A person, in order to be eligible for Medicaid, must show the state, listen, I don't have a lot of assets. This is my income. How do I qualify? Do I qualify? This is a list of my assets. And in many cases, the state reviews the assets, what the person owns, and says, yes, you qualify, or no, you own too much. Now, this may seem strange to the average person because they're not necessarily aware of what the state limit income amounts and asset limits amounts are to disqualify them. They just expect that, oh, they're sick, Medicaid is available to them, or it should be available to them, and that they should get it. In a normal world, in the civilized country, yes, that would be how it is. But in the US, insurance provided by the state and federal government is based on need-based, meaning you have to show financial need in order to qualify. So many seniors, unbeknownst to them, who own homes, who have retirement accounts, who have 401ks, have pensions, unbeknownst to them, have to divest themselves of these assets in order to qualify for Medicaid. Failure to do so, Medicaid can say you own too many assets, you don't qualify, or put a lien on those assets. In many cases, it's the home that they put the asset on, the lien on. So what many people who have the foresight to do to qualify for Medicaid later on go to an estate planning attorney such as myself, and they say, I'm getting older, I want to do an estate plan to protect my assets to ensure that my children are recipients and beneficiaries of them. How do I do that? So an attorney would comprise an estate plan of trust, irrevocable trust, which is the particular trust that allows asset protection and preservation so that that person can qualify for Medicaid if they need it. Now, you may be wondering, what about Medicare, Medicaid? What's the difference? So Medicaid is need-based. Medicare, for the most part, is based on age. So a person who's 65 years of older can qualify for Medicare. But Medicare does not cover most nursing home facilities care, which is what Medicaid then comes in and supplements what Medicare doesn't do. But remember what I said, that you have to show need in order to qualify for Medicaid. So although it could be a shoo-in to get Medicare, to get Medicaid can be more complex. And what nursing home facilities iron out, if a person does need nursing home care, the nursing home facility would say these amount of services are covered under Medicare, but these amount of services are covered under Medicaid. So you have to pay. So if that person doesn't have Medicaid, then they may have to pay out of pocket for those expenses in the nursing home. But again, Medicaid is not exclusive to nursing home stays. Medicaid can also kick in to cover a medication or prescription drugs that a person may need, personal care services, eyeglasses, hearing aids, emergency ambulance services. So that's what Medicaid is typically supposed to cover. And Medicare would cover like inpatient hospital stays, skilled nursing facility care, hospice care, some home health care programs, some drugs, medical supplies and equipment, lab tests, surgery, rehabilitation, and therapy services. But when a person is ill, it's hard for them to piece together the puzzles as to what Medicare is going to cover, what they may have to pay out of pocket if they don't qualify for Medicaid. And so a person who has the foresight will seek out an estate planning attorney in order to make sure that they can qualify for Medicaid in the future if they need it. Why I'm a proponent of Move Abroad is that if a person did not have the foresight to meet with an estate planning attorney, that means most of their assets are up for grabs to A, disqualify them from receiving Medicaid, or where the state says you own too much, you're going to have to pay out of pocket, and the out-of-pocket expenses can impoverish someone if their out-of-pocket expenses for healthcare needs. Healthcare needs can run in the hundreds of thousands, sometimes millions. So what is a person to do? So I see moving abroad as a viable option to preserve assets as well as ensure that the future generation gets to benefit from what their parents and their grandparents worked so hard for. So it's really a solution for this healthcare crisis that I see, because if you move to a country, most countries have universal healthcare. So even if that person has a chronic condition, they can access affordable healthcare that won't bankrupt them. Even if they have to pay, in many cases they do, out of pocket for private insurance in said country, it's still going to be substantially less than them having to levy their assets in order to pay for medication or nursing home facility care. I want to give the example of one woman I spoke with a few months ago who retired and sold her house and used some of the proceeds from the sale of her house to buy a Winnebago. And her dream was to travel around the United States, just camping out, visiting friends, and enjoying her retirement. Unfortunately, she became ill and received a diagnosis that was terminal. And they said she pretty much had 3 months to live. This was all unbeknownst to her. She had no health issues prior to this. And so she was in a nursing home facility, palliative care at this point. And she called me from the palliative care facility and she says, I need to know what to do because I'm having to pay out of pocket for my monthly expenses in this center. What can I do to preserve the money that I do have so that my children can get it? And unfortunately, the bills were $5,000 a month that she had to pay out of pocket to the palliative care facility. And she was seeing that her retirement income and the proceeds from the sale of her home was diminishing quickly. And she wanted to do something to preserve it for her children. And there wasn't many options for her because they told her that she was terminal, that she had 3 months to live. But she wanted to die quickly. And I remember her saying this, and she emphatically said, I hope I die quickly so at least my children get more than less. And she said, well, they can also sell my Winnebago. That's worth something in case the palliative care facility eats up everything in my savings. And no one should have to go through willingly wanting to die in order that their children inherit. But that's the state of healthcare in the US. And so this phenomenon, this shift, where wealth was supposed to be transferred to the successor generation is in a way being undermined. I don't know how to say this without sounding like a conspiracy theorist, but the wealth that the that baby boomers were supposed to transfer to the younger generation is not being passed on. And that's because of several factors. That's because of, well, as I mentioned, healthcare, the healthcare crisis. There's no socialized medicine. And so the baby boomers' income is being divested to paying for their healthcare. And there's also inflation that's attributed to that. Baby boomers are also having to work longer. And there's other dynamics at play too. And I do see moving abroad as a solution, like I mentioned, because you can move to a country that has socialized medicine and pay substantially less for even extensive health care, even if it's cancer, even if it's nursing home care. You could pay substantially less than you would in the US. If you have any questions, let me know in the comment section. If you would like to work with me individually, I do have a moving abroad coaching program. So if you're considering moving abroad and you do not know where to begin, then you should come into my coaching container. We'll iron out the steps that you need to be considering regarding moving abroad. And another important dynamic about moving abroad is moving abroad with aging parents. What do you do with them? So we could come up with a plan for them as well. Perhaps they could come on the journey with you. I will see you next time. So the link regarding that is in the description box if you would like to sign up for that. And I also have a medical tourism trip for Colombia that's approaching. So if you have inadequate healthcare insurance, or you don't have insurance at all, but you're in need of dire healthcare attention, then I invite you to think about becoming a medical tourist. We'll be taking a trip to Colombia in the next few weeks, so I will have the link for that in the description box, and I will see you next time. Bye bye.